today we're taking the opportunity to talk about gastroenteritis, which is a very serious issue.
Well, gastroenteritis is kind of a fancy term for vomiting and diarrhoea, the symptoms of vomiting and diarrhoea. It's caused by a range of bugs and viruses.
The seriousness of the gastros, it's very serious because the vomiting and diarrhea can lead to dehydration, especially in the elderly patients. And so we really want to try to stop the spread of it.
Gastroenteritis is extremely severe, particularly in the elderly. They get projectile vomiting, it comes on suddenly, abdominal cramps, nausea, poor appetite, and are especially prone to dehydration, so become unwell extremely quickly.
It's especially important if you work in a job where you're preparing food for others, if you're working with young children, or if you're working with the sick or elderly. So staying home is pretty crucial.
It's highly contagious and it can be spread within 10 to 50 hours. Comes on suddenly.
Yeah, it can spread very, very quickly. Different types of gastroenteritis don't spread as quickly, but the norovirus that we've had a few cases of lately, it spreads very, very quickly and it's very contagious. You only need about 10 particles to get it, and the other thing about it is that just because you've had it once doesn't mean you're immune as well.
A healthy person who's infected, who's having to deal with these symptoms, might actually find them quite manageable, but that all assumes a healthy person. The big thing is if they are not a healthy person, then these bugs and viruses have the ability to cause serious illness, even death. And it just depends on if they're the right kind of person, and by the right kind of person, that's someone who might be immunocompromised, so a compromised immune system, someone who's pregnant, or the elderly, or someone who's having to deal, in a hospital having to deal with an infection already or recovering from a surgery.
If you're a staff member working in an area, if you develop the symptoms at home, please don't come to work, and you need to stay away for 48 hours symptom free. And that's critical. You shouldn't be mucking around with that when you're working in health. And then for patients, if they develop the symptoms, we need to isolate them, so we'll put them into one of our isolation rooms and just monitor them, and the staff caring for them need to go in wearing gowns, gloves, and depending, norovirus can become aerosol, so they need to wear masks, and that's quite critical for stopping the spread.
Hand hygiene's the biggie if you're the person going in there, and just maintaining really good hand hygiene.
Staff need to be extremely vigilant, particularly with hand washing and cleaning all surfaces, putting on protective equipment, going into all the patients and other patients as well. It's extremely hard work, particularly when you do have a ward full of patients who are vomiting and have diarrhoea.
The other thing I meant to mention about staff, if staff develop symptoms at work, obviously we want them to go home, but they also need to make sure they let someone know that they may have used a toilet that we need to clean, so we need to make sure that toilet's closed, and then we get the cleaners in to clean it before someone else can use it. We do an exercise with all our staff when they come and work with the DHB, especially our clinical staff, and it's a very simple activity when we put a hand cream on their hands, and we say to them, think that's it could be a gastroenteritis bug or whatever. So we get them to rub it into their hands, and then we ask them to go and wash their hands. And we're having a look to see how well they wash their hands. The other good thing is just to have a look at all the areas that your hands might touch when you've got that on. You can see the high touch areas.
So things like door handles, areas in and around toilets and bathroom facilities. Viruses like norovirus have the ability to stick around on hard surfaces for a long time. That's why cleaning and sanitising hard surfaces, if you're in an outbreak scenario, or if you suspect you have norovirus at home, those are kind of key things.
But just be very aware that your hands are one of the major ways that you can spread this infection, and we don't want that happening.
Particular importance, hand hygiene, personal general hand hygiene. And then if you are unwell, it's staying out of places where you might spread it to people who are not healthy.
Keep yourselves at home, keep well, keep up your fluids.
Yeah, so staying hydrated is pretty crucial because through diarrhoea and vomiting you're going to lose a lot of water.
Eating if you can. Do seek medical attention if you're not getting better within the next 24-48 hours.
So the big thing, the take-home message with the symptoms is if you've got symptoms of vomiting and diarrhoea, then you should be staying at home until symptom-free for 48 hours.